Welcome, everybody, to From Lab to Market, a showcase of research impact through commercialization.
So just to clarify which Matt is which, I'm Matt Crott, I'm the CTO of ResusRight, and I'm joined by Matt Baustrid, our CEO. 10 million babies every year around the world require resuscitation at birth. 2.1 million of these are left with a disability or die during this process. And these numbers really struck me when I first learned about them. Even being slightly premature myself and having a sister that was stillborn at 22 weeks, I really had no idea about the extent of the problem. But what I do know is that behind each one of these numbers, each one of these statistics, is a baby, a mother, a father, a family, a community, a nurse and a doctor that have an eternal impact from this process. And incredibly, the World Health Organization estimates that most of these are preventable. I didn't know about it. However, out at Westmead Hospital, Dr. Mark Tracy and Dr. Murray Hinder, they did know about it. They'd seen the technology that has been developing in the neonatal intensive care unit, and they knew that the problem could be solved. So enthusiastically, I put my hand up, and so did Matt, and we tried to tackle the problem. And that was back in 2018. So after completing our honours degree, having built the first prototype, we were straight out of uni, bright-eyed and bushy-tailed, and volunteered to stay on as an intern. I had no idea what we were signing up for. I quickly realized that it wasn't just all about doing great research and building cool prototypes. There was an entire path to market that I had no idea about. There's all the clinical trials, the regulatory approvals, the distribution, the manufacturing, the sales, all of that stuff. And it wasn't as simple as it first seemed. When we first came out of the Remarkable Tech Accelerator, I think we wanted to raise 400 grand, and we said that will take us through clinical trial, to market, all of that, and $2.4 million raised later, we got our training device to market. And that's a device to help clinicians resuscitate and learn how to resuscitate better. And there have been so many amazing people that have helped us along that way. From Alistair and the university, who have allowed us the flexibility to do our PhDs while trying to start a startup, to Rupal, Greta, Carla, and Jane and the team at the Sydney Knowledge Hub, who gave us those 2 desks at the start that have now grown to 9, and a hardware lab to go with it. The Cerebral Palsy Alliance, whose grant allowed us to start working full-time on the project, and Remarkable, as I mentioned, and they're amazing mentors who, all together, we wouldn't be where we are, wouldn't be up here on this stage without everybody.
So I recently heard an analogy that having a startup is like having a child. Starts off as a baby, makes a lot of noise, everyone knows about it, but it's not quite at the stage where it can do much yet. And it takes a lot of time, effort, and resources before it matures, and it can go out and make an impact on the world. Like a child, if it takes a community to raise a child, it also takes a community to raise a startup, and I think that's sort of been amply illustrated by Matt up here today. There's been a continuum and a confluence of factors that have sort of enabled us and supported us on our journey to get to where we are today. That started, as Matt touched on, in the very earliest stages with that connection between Westmead Hospital and the University of Sydney, which connected the clinical domain expertise with the engineering know-how to be able to actually develop a prototype solving a real-world problem. Another thing that helped out in those early days was the engineering industry placement scholarships, which allowed me to join onto the project. And then critically, Alistair introduced us to the Remarkable Tech Accelerator program, which really provided us with the impetus to turn this from a research project into a commercial venture in a company. Now, those sort of early themes can be distilled down into some main areas. Firstly, just the awareness of that research commercialization is a viable path was so important for us to realize that we can actually go down this path. The second thing was our connection with expertise, both upskilling Matt and I, but then also connecting us with the network that's required to support those entrepreneurs on their journey. And finally, the funding that acts as that fuel for all of the commercialisation activities. And if all of those are in place, then you get to see Australian IP and Australian companies tackling global problems, like you can see in that picture behind me, our Juno training monitor being used at a hospital in Hanoi to help out with their resuscitation training program. So our vision is that is a world in which no baby dies or is left with a preventable disability at birth. And eventually we want to see one of our monitors at every birth where it can help out if any baby requires resuscitation. We've recently just completed an FDA, a first-in-human trial, at Westmead Hospital, looking at our resuscitation monitor on 12, to help 12 vulnerable babies. And that was incredibly rewarding to see our technology out there helping real babies for the first time. The next stage for us is FDA clearance, and we're currently raising a Series A funding round to give us the funding to enable that to happen. But right from the beginning of our journey, there's been some very close relationships that have persisted and have provided us with the assistance to get to where we are today, with the University of Sydney, with Westmead Hospital, with Cerebral Palsy Alliance. And we're very excited for those relationships to continue as we move forward to achieve our vision. Thank you.